From Clinical Crossroads Trials on the Efficacy of Medical Marijuana, we read, use of marijuana for chronic pain, neuropathic pain, and spasticity due to multiple sclerosis is supported by high-quality evidence. 6 trials that included 325 patients examined chronic pain, 6 trials that included 396 patients investigated neuropathic pain, and 12 trials that included 1,600 patients focused on multiple sclerosis. Several of these trials had positive results. This suggests to us that marijuana could be quite helpful with these diseases. From Edward Ma's study, we read, Charlotte, a little girl with SCN1A confirmed Dravet syndrome, was recently featured in a special that aired on CNN. Through exhaustive personal research and assistance from a Colorado-based medical marijuana group known as Realm of Caring, Charlotte's mother started adjunctive therapy with a high-concentration THC CBD strain of cannabis, now known as Charlotte's Web. This extract, slowly dosed over weeks, given in conjunction with her existing anti-epileptic drug regimen, reduced Charlotte's seizures frequency from nearly 50 convulsive seizures per day to now 2 to 3 nocturnal convulsions per month. This effect has persisted for the last 20 months, and Charlotte has been successfully weaned from her other anti-epileptic drugs. In my own personal experience, I've seen the devastating impact of epilepsy and the curative effects of marijuana upon this destructive disorder. My brother-in-law has seizures multiple times a week. It resulted in many job losses and a large job search for him, and anxiety for his family. Through his use of marijuana, he went without seizures for 3 years. That's amazing. With such amazing stories and evidence behind these medical benefits, why is it that we have yet to legalize even medical marijuana in every state? According to Dr. Seth S. Crawford, the CSA, Controlled Substances Act, established a 5-tier categorization in which drugs of specific substances are ranked according to their potential for abuse, current accepted medical use, and treatment under international treaties ratified by the United States. Marijuana was placed in the most stringent category, Schedule 1, which is reserved for drugs with a high potential for abuse, no current accepted medical use, and a lack of safety associated with its use. But does medical marijuana deserve this status? We also find in Dr. Crawford's dissertation a grouping of disorders that marijuana has proved to be effective in. Marijuana has therapeutic potential for inflammatory disorders and diabetes, alleviating muscle spasms, and as an anti-cancer treatment. Additionally, it provides positive immunological effects, suppresses or reduces symptoms for those with epilepsy, depression, chronic pain, post-traumatic stress disorder, glaucoma, migraines, erectile dysfunction, Tourette's syndrome, severe nausea, and cachexia. Now, does this sound like a Schedule 1 drug to you? When reading this, I was absolutely amazed to hear the sheer number of disorders and diseases that marijuana treats. It seems to me that there is a near limitless potential for marijuana and its affiliates. I present to you this information with a question. Why should we treat something medically different because it's used recreationally? The simple reality is, we shouldn't. Alcohol is used for both disinfecting wounds and for high blood pressure medication. Some people's doctors will recommend this. And it's also used recreationally. And we seem to be more okay with this. The simple truth here is that the government made a mistake by classifying marijuana as a Schedule 1 drug. There are many drugs that are less effective and more addictive on the market today, and just because something needs more research put into it does not mean we should call it dangerous or useless. Quite the contrary. It means that there is all the more reason to study it and figure out its beneficial effects, especially with something like marijuana. It's proven effective on many realms and many fields. So let's give it a chance. Let's give it a chance. That's what I say.